the end of the session. And we will kindly request Dr. Prof. الدين الجابر for the new lecture that is approach to hypertensive patients. So thanks to the Dr. نور.
بسم الله الرحمن الرحيم. أسعد الله صباحكم بالخير جميعا. أنا سعيد دائما أن أبقى معكم وأشارككم إن شاء الله سنويا هذا اللقاء العلمي الرائع، وبحضوركم نزداد فرحا وعلما ومحبة. فإن شاء الله كده just will move with you rapidly an overview on hypertension. Slides. So at the beginning, I have nothing to disclose. Can we return back to slides? Yes. I have nothing to disclose in this nice talk. So it's a matter just to thanks الشركة اليمنية المصرية لدعمهم هذا اللقاء العلمي. So they are supporting and they are really doing a lot of efforts to make it nice, to make it comfortable, to make it, more scientific. So at the beginning, the big questions in the mind of any one of us is still asking, do we still need more to know about hypertension? Actually, it is a biological process. Every day, it's a change. Every day, you have a new information. Like in the oldest statement of Brunwald in 2012, he said that hypertension is a silent killer, asymptomatic, chronic disorder that undetected and undertreated silently damage the blood vessels, heart, brain, and kidneys. So that's why the most important organ related to the hypertension is the heart, the peripheral vascular, and the kidneys. And even the heart, they are leading to affect the heart by different modalities. So leading to left ventricle hypertrophy, then it's fail, and even the arrhythmias. In the kidneys, they are leading to sodium and water retentions, and this also decrease the blood flow of the renal and renin-angiotensin system activations. So the first item of hypertension when it is start يمكن أول ما اكتشفوه كان في الرئيس الأمريكي روزفلت. فهي gets cerebral bleeding, and then the doctors, beside the doctor, they asked what's happened to the president, and they said that the president, he have something high in his blood vessels. They discovered that the hypertension. And they try just to monitor for the president, how is the ECG and how is the left ventricle size. They find it's a little bit hypertrophied. From that time, which is just in 1945, they are still progressing in knowing hypertension. لحد الآن, still that the hypertension is the first risk factor for global mortality. So it's just number one. If you just look to the screen, it is the number one risk factors. Even so, because we have a lot of knowledge of hypertension, is still undertreated. You will find تقريبا resistant part of hypertension reach 9%, and even uncontrolled hypertension in some countries leads to 38% or 40%. So again, it is still undertreated. We need more and more to do. Even it is very costly. If you see how much the annual cost for hypertensive patients, around $370 billion. يمكن أكثر من ميزانية الدولة. So it is very costly. They are expecting in 2025 that 1.6 billion hypertensive patients it will be there. يمكن in the Gulf countries, half of the societies, they are hypertensive. So in Yemen, we don't have a good study, like I will show you some of the studies in Yemen, how is the situation. وعشان كده يمكن أول ما بدأ الهايبرتنشن enter in studies, enters in scientific things، كان أول سؤال في كل الستاديز اللي تعمل الهايبرتنشن السؤال يسأل should we treat diastolic hypertension؟ لغاية ما grow all the studies like that كان السؤال في 20s that can we prevent hypertension soon؟ So this is the questions now. وعشان كده يمكن كانت most of the studies, and we are going like that till the last guidelines. It was in 2023 that the European Society of Cardiology, European Society of Hypertension, they brought the new guidelines. By the age that the hypertension it will increase. So guess when we grow in age, becoming older, the percent of hypertension it will be. So again, it reached in 18, around 65% of the population reach this age, they have hypertension. وعشان كده يمكن عالميا بدأت a lot of societies, a lot of people, they are doing, a group for treating of hypertension. يمكن حتى في اليمن we have that Yemeni hypertension society. Like it is just grow up and then it is sleep with the other societies. فعشان كده if we just thinking of hypertension, what we record only a marker of big problems. So the truth that the hypertension is multi-organ system disease. It's not a matter of one disease. So the problem is hypertension, even it is asymptomatic in patients. Around 85% of patients, they are asymptomatic, without any symptoms. So how to be wise thinking of hypertension? The first things you will keep it in our minds, something it is wrong that we consider hypertension, it is isolated disease, which is wrong. The other points that root of these things, that hypertension, dyslipidemia, diabetes, obesity, they are coexisting disease. And they are the four ball bearers to a grave of coronary heart disease and cardiovascular system disease. For all of these things, so we have to act as a primary or secondary prevention of such a disease, including therapeutic lifestyle. So if you attack one of these four thieves, so you will help to attack the others. What's in the mind of physicians? How we think of hypertension? The first things, if we guess simply that isolated hypertension is often doubling the age risk factors, as you see before. And the other points, we are considering hypertension, it is an arm effect. No, so the hypertension is affect the body. It's not a matter of measurement in the hands and so. The other points, the concept of the pulse pressure, usually we ignore it, which is very important in management of patients with hypertension. Usually, if we give a patient hypertensive medications, we are worried about side effects. We should not worry. We should just observe, we should just watch. If it's okay, if it's happening, we should manage. Again, some control is cheap. This is our some people's goals. But the idea why we are not attain to do the goal of blood pressure control. So not insisting in compliance with drugs or assessment. So that's mean you will give the patient drugs of hypertension, but you are not insist to tell him this is a major risk factors, you should receive the drugs, you should be in follow-up, and so on. So again, you should think pressure of patients. They are asking you how much my blood pressure, how much. It's not a matter of numbers. Whatever it will be the measurement. So a matter of systemic disease, we should concern about it. Again, concerning on the bill, not on the L. So you will concern only to giving the drugs, but are not concerned about patient as a whole, including therapeutic lifestyle changes. So hypertension, it is really a matter of headache. So why it is like that? Because it is biological continuous variables. So there is no cut point you can say this patient is hypertensive like that. So after that you will see how much the different in measurement of the blood pressures. This is normal, this is subnormal, this is abnormal, and this is grading like that. So this is a headache of hypertension. Again, keep in your mind that it will double the risk by the time. يمكن في الفيرست societies of hypertension كانت الجاينت national committee with the WHO, they consider this number is good controlling, 140/90. This is a good blood pressure. Above this, it is serious, and below this is active. Nowadays, this number is strong. So they consider even in American Society of Cardiology and American Heart Association that the blood pressure of patients should be less than 120/80. Below these numbers, above these numbers, considered to be any type of hypertension. Either it is elevated or high blood pressures or stage 1 or stage 2. So this means the numbers, it doesn't mean. So we have to take all of these numbers beside the patient as a whole. Because we know that the progressions of the blood pressures start from the hypertension till death, like that is going in these sequences. So for these things, for management of patients' hypertension as a whole, you should know how to measure it well, you should know which classifications, which investigations, how to risk assess, what are the non-pharmacological or pharmacological management, which drugs you will start, which drugs you will not give, and what are the target you are going to do, what are the concomitant disease with this blood pressures increase, hypertensive, diabetes, dyslipidemic, whatever it will be, you should just manage it with hypertension. I think this slide, almost all of you know it, how to measure the blood pressure, supported, arm close to the heart, not crossed legs, just the doctors close to the patients like that. Usually, I think most of us, we are not doing this in a proper way, which is very important to say this patient is hypertensive. Just for example, if the patient is just sitting in front of you, his crossed leg, so the systolic blood pressure is a little bit to be increased. So you just keep to measure the patients properly. The other point which I want to change your mind on it, we have different form of measurement of the blood pressure. Sphygmomanometers, aneroids, this is electronic, this is the monitoring of the blood pressures. Which one of them is correct? Yumkin, all of us, before we are thinking that the mercury is the best one. Like with a new development, we can guidelines like that is going like that in this way. Yumkin لو حصلنا most of the guidelines, they are using the electronic ones. Yumkin this one is not used properly, or this one is obsolete. So this is a change how they thinking of measurement of the blood pressures. ويمكن ما هو دعاية, يمكن just only 2 companies they are just approved their product is a nice product. واحدة من ضمنهم is AMRO. Another company, it is German companies. They are using these ways, and the most of the hospital, they are using these machines to measure the blood pressure. This is the way how to measure it. I will give you an examples for Yemeni experience in hypertension. So this is just one of the experience which is presented in the national conference. So we're taking the prevalence and risk factors associated with hypertension among Yemeni patients. This is again supported by Yefko. So they are doing this research, and what we conclude from this research, can me beside all the managers in Yefko, they are supporting these things. So I will give you the conclusions later on, what we find, what we are discovering in such project. Other Yemenis experience in hypertension يمكن كان في the Gulf race. لو شفتم اليمن هنا يمكن تقريبا 34% من الناس اللي دخلوا العنايات المركزة because of acute coronary syndrome, they are hypertensive. So this is the Yemeni experience. لو شفتم بقية الجلف countries, they are يمكن higher than Yemen. They don't know because of populations or because of other things. لكن still in Yemen we have high incidence of hypertension. عشان كده يمكن many studies in Yemen they done regarding to the hypertension. So يمكن the prevalence يمكن كانت واحدة من ضمن experience with good studies, Prof. Grenade studies, they find تقريبا 30 to 40% or even 20% the usual calculations, they are hypertensive. And they just do many studies in Yemen. If anyone you want to read them, you'll get them. So what we did in our study with Yefko, so the population, it is their groups in their factories. What we find, we got studies because of these huge numbers, around the number of employees around 17,000. So guess this is how much we examine, 10,000 people they are examined in hypertension. What they conclude, 66.6% of the patients, they are hypertensive. There is a huge number. So I think this is the preliminary result. يمكن هذه النتائج الأولية اللي حصلناها. لكن I think we have to do sub-analysis to see which the actual things. ولو فكرنا بس كيف كانوا الهايبرتنشن, most of them they are in stage 1 of hypertension. وما كان في difference between the Yemenis and other research in hypertension regarding to the gender, weight, diabetes, and the family history. And we recommend for the government that the findings of this study, we should just to take it in consideration for healthcare and for the other health policies to do nice things for our populations in Yemen. You know that hypertension, there are many different types, essential, borderline, systolic, diastolic, reactive, and so on and so. Like the doctors, they are staying in dilemma. How, when, where, how to do all of these, the questions coming and needs answer to work out of hypertension. وعشان كده يمكن قسموا الستبس of diagnostic of hypertension to 3 steps. The first step just thinking of basic diagnosis of hypertension. Well, this is the simple assessment of hypertension, including searching for target organ damage, and then the cardiovascular risk. Then if we just grow more to investigate for hypertension according to the phenotype and the clinical suspicions, if it's renal, suprarenal, and so, go for further things. If the patient is resist hypertension, that means you need more investigations to detect what's the cause of hypertension. And then do what we call is risk assessment to evaluate the patient, to manage the patient's hypertension.
15 minutes now.
We need more 15 minutes. I'm trying just to go rapidly. So it has to do the risk of patients of hypertension, and even you think of hypertension-related risk factors, the cardiac, renal, the eye, and brain, and vascular things. Think to treat hypertension, either it is non-pharmacological or pharmacological management. هل في فائدة عشان أعالج ضغط الدم? The answer is yes. If you see just the incident of risk, it will stroke risk reduced to 40%, myocardial risk 25%, heart failure up to 50%, it will be reduced if you manage hypertension. Again, Birmingham study and Vet Adam studies, they find that management of hypertension will reduce the morbidity and mortality. So thinking of management, either it is lifestyle of medications, so again, you should just keep the patient with you in management and do what we call risk assessment. This patient, which type of risk and which drug is suitable for these things. ويمكن الآن في الأوروبيان society موجود الجدول هذا تعرف which patients have the stage or the number of hypertension, what are the risks, in which place he is, and then you will management accordingly. وعشان كده بدأت كل الجايدلاينز societies in this ways. يمكن من اللايف ستايل measurement, the weight, salt intake, physical exercise, fruit and vegetable, and fat, what we call is dash management of hypertension. It should be considered like that and should encourage the patients to do like this. Keep in your mind that the rules that the hypertension is cardiac output and total peripheral resistance play on all of these parameters. Heart rate like beta blocker, stroke volume like diuretics, arterial or venous pressure reductions by other modalities of hypertension. حتى لو فكرنا بكل المودalities of hypertension نحصلها it is a dilemmatic things. If you select one of these columns, you will enter in dilemma. Which drugs you are going to select? This is just how to select these drugs. You should just do the most appropriate, tolerable for the patients, should be rational and per se approved in the guidelines, and again do what we call the class 1 recommendations in management, is suitable for patients per se, it should not cost, and should not never be arbitrary in management. ما يكون استعباط، يكون it's a matter of plan. It should be better long acting rather than short acting. Treat the compelling indications, do the interactions, know the interactions and side effect of drugs, and this is why you are going to treat hypertensive patients in these ways. Thinking of combination therapy, it is very advisable, even though the management of hypertension is still again difficult. We have a lot of challenges and how to optimize it and how to guide the patients and the community, because it is reverting the normality to normality. نرجع المريض للنورمال. It's a matter of biofetal rule of prevention. Doctors, patients, society, and so on. Think of resistant hypertension. Think of emergency and crisis hypertension, how to manage it, and should just keep in the target organ damage and the blood pressure what it's doing. So they are thinking nowadays of hypertension, so they stop or continue. في وقت ولا يكفي؟ أنا بس أقول لكم خلاص 5 minutes. I will tell you guys what's the new in hypertension management. So they estimate like community, you just enter the new drugs like ARNI, SGL2 inhibitors, the denervation therapies, the environmental factors, وكان هذا في أكبر مؤتمر حضرناه. They think to intensify the blood pressure in this study, they are using what we call the denervations. يمكن أكثر علاج الآن مشهور they are using in obese patients the Ozempic in management of obesity, and they are also again thinking of resistant hypertension, where they are start the genetic therapy of hypertension in a new management. The 10 takeaway messages from the update. أول message إنه no change in classifications of hypertension is still the same. The new message, you should just influence in the risk of factors of hypertension. The other message of environmental change, like something like pollutions and other stress, you should change it. Again, to know how to measure the blood pressures nicely. The update message is lifestyle modifications. They put potassium in management of hypertension. Use of beta blockers nowadays entering in management of hypertension. Use of combination therapy, it's better rather than single management. The 8-up diet, single pills combination therapy is better than one drugs in management. The other ones to treat hypertension on heart failure, you should enter the SGL2 inhibitors and ARNI if you are new, use it. The last message is novel telehealth communications of patients with hypertension. So that's mean you know diagnosis, how to treat, how to follow the patients is in hypertension. What's in the future? إن شاء الله لو حصلناكم في محاضرة قادمة